Stand up for yourself, and I'll back you up. 'Cause problems don't solve themselves. I'll tell you what, instead of would or could, I think you should draw a line in the sand and stand your ground. It's for your own good.
Hello, my name is Roy Poyan, and I want to welcome you to another podcast of The Voice of Families in Addiction. Today we're going to take a look at the choices that family members have when they are addressing mental health issues and they're seeking a professional service and trying to find the right level of care. Well, we want you to know that there are a lot of different levels to consider. And in doing so, we would take a look at the different types of tools used to help us make that determination. There is a group titled ASAM, and their role in one way is to design and keep current a criteria that clinicians and professionals use to determine what type of services are going to best fit the current needs and the future needs of a plan of care once a diagnosis has been determined. So who exactly are we talking about? And you might say, well, Roy, we're always talking about the family. That's correct. But in this case, we're talking about a lot of people. And this is where multi-dimensional, meaning many different people as a dimension for each, is considered in the family therapy. MDFT is what we'll use as the acronym for multidimensional family therapy. And what we're going to do is we're going to suggest to you, it's important to know, well, why that over something else? Well, then let's also compare it to what is the something else. The something else typically for youth, age 10 to 26, would put us into a residential care level type setting, most commonly provided as a service for treatment and therapy. So then if we're just talking about the person, where again does the family come in? And you notice I'm always keen to the idea that's nice for the person, but what about the family? I'm about you, the family, more so than I am the person that's misusing substances and what that impact is to you. But we have to understand that person's journey because their journey quickly becomes our journey. So let's take a look at this. This is a clinically proven therapy in the area of family therapy, in the area of psychology and mental health. And studies have been created that have helped to structure what we're doing, why that's of value, and what can we expect as being the possible outcomes when we're using it. In multidimensional family therapy, there were several actually, randomized clinical trials delivered in the home and community matched or surpassed residential treatment on all study measures. Let me repeat that. Multidimensional family therapy exceeded the expectations based on a criteria of that was set for residential treatment, which is the standard of care. So we're getting into we're starting to change things inside the mental health field. Yes, we are. And they'll change even better if you as a family member understand them. Because let's face it, when you're going into a mental health service or therapy selection, that decision is yours, not theirs. And I think we've abdicated our decision-making to them, meaning the mental health industry, on the basis that we really don't know. And the answer is stop that. You should know, you can know, you will know. And that's why we're here. There's going to be some work on your part because nothing comes without work that's worth doing. So with that in mind, we'll help guide you through that. So included in a criteria for substance use is delinquency and mental health symptoms. This kind of counters the conventional wisdom that youth with complex problems can only be adequately treated in a residential setting. Well, that's no longer the case. I'm not going to say that's bunk, but because it is true, they are successfully treated in a residential treatment setting, very successfully. But it doesn't mean today that it's the only choice. And now we're introducing multidimensional family therapy as being one of those alternative selections. So multidimensional family therapy is an effective alternative to residential treatment that can be delivered at a lower cost without removing the youth from the home. Well, as far as the family is concerned, that's big. That means you're not dropping them off in Pennsylvania and coming and visiting them. But it's multidimensional. So what does that mean? I mean, obviously they put the word in there for a reason, and we're going to describe to you what that means. But let's talk a little bit about why would we even care? Well, it's the results is why we care. Take a look at this. In a comparison study of multidimensional family therapy to residential treatment, multidimensional family therapy decreased in substance use from the point of intake to 18 months, because everything's on a timeline, 71% reduction. For residential and comparative within the same study group, it was 53%. Now that's good, and that's been the gold standard up to now. But now with multidimensional family therapy, with this delivery with the home, with the family, we're speaking of a 71% drop. Well, other characteristics, because that was just their use of substances, other behaviors, other types of criteria would include delinquent behaviors. Delinquency meaning, kind of a criminal activity, or they're being a delinquent. This decreased by 42%. Now, you might say, well, Roy, that's not very much. Well, for residential, it only decreased by 17%. So are you starting to have a bar chart in your mind? Because you should. Substance use disorder decreased 71% with MDFT, and with residential, 53%. It decreased delinquency behavior by 42%, almost half, and residential treatment by 17%. Another criteria was how many people finished the program. Oh my gosh, I can't begin to tell you, against medical advice, AMA, it's just astounding how many people walk out after they just start an inkling of feeling better, which the family can help that not to happen. And typically they do when they know what's happening and going on, and they've got knowledge. And that's why we're talking to you today. So those that completed at least 3 months of treatment, 96% with multidimensional family therapy, almost half with residential, 57%. So we had a much, much, much greater impact, because the longer they can stay with us in treatment, the stronger they get, of 96% at least 3 months. So we're lowering costs, and we're lowering significantly their use, and we're lowering their delinquency in terms of criminal activity when we comparatively use the MDFT in comparison to what's available today. I have to tell you, that's great news. Anything that puts the margin of success in our corner is something that's worth asking for. Now, you could go on YouTube and you could learn an awful lot about multidimensional family therapy. And honestly, I would. If you have somebody in that age bracket that's currently misusing substances, it's really in your best interest to become really smart, and then find somebody in your HMO network by calling them and saying, I want a list of family therapists that practice multidimensional family therapy. The other one that we would suggest, that it's not us that's suggesting it, it's the NIH and it's the SAMHSA group and these empirically proven studies that are suggesting it. And what they're also suggesting is Bowen family therapy. So I don't want to confuse you with a bunch of therapies, but I'm going to confuse you with a bunch of therapies. So you may want to get out a pen and paper and write some of these down. There's there's 10 guiding principles to multidimensional family therapy. It's an adolescent drug abuse in multidimensional phenomenon, meaning when you have an adolescent and they're abusing drugs, that it is multi-tiered, all the different areas that they impact and mess around in. But it's also a lot of things are going on with them. As an individual experiencing this journey with drug and drug abuse, biological is one of them. Their social is being impacted. Their cognitive, their personality, their interpersonal skills, their familia in terms of family, the development and social aspects. It all develops and has a continuation of worsening in a chronicity of drugs. So the family function is instrumental in creating a new development and adaptive lifestyle alternatives to adolescence. So what did I just say there? Well, it sounded really cool, but in all practicality, what we're saying is that we're going to help you guiding you towards a new you, creating, because this is new and it's not going away. You can resist it and deny it and walk away from it all you want. It's not going away. It's a big sledgehammer that keeps pounding down on the top of the head of the family, like a nail being driven into a board of wood. So what we're suggesting is, let's lighten that hammer, and we can do that by creating a new us. Not a completely new us, but an adaptive new us, a new lifestyle of alternatives for having this person. Typically what we're speaking about is an adolescent up to 26. So the youth's relationships with their parents, siblings, and other family members, it's fundamental in areas that we need to consider. How does that person interact in the family dynamic? We need to kind of like list it out and then give each of the listing items some air and some breathing room and have a conversation on each one individually. It's the day-to-day family life environment that offers numerous essential opportunities to retrack ourselves in developing a stronger functionality of the family. I hope all this is sinking in, because this really is your lifeboat in all of this. Because that ship, known as your family, is going to sink. And if you don't want to, don't do anything. Just stay on the ship and go down with it. Because then you'll all start arguing with each other and the family will start to fall apart. Divorces are rampant in this because of the impact to the family overall and stress and trauma. Now, with knowledge, we could change that. And that's your work that you need to do. So problem situations that are presented are actually opportunities. I know that sounds kind of like a little sick, but it's not. Because with the problem, once we've identified it, the opportunity typically makes us stronger when we work at doing it. We become better for it. We're not going to thank somebody for creating a problem so that we could resolve it and become stronger. That would be sadistic, or masochist. But in that sense, that's really what is happening. So intervention opportunities is probably a better phrase that you'll find people looking at. So what does multidimensional family therapy do for adolescents that are kind of like in abuse in terms of the family and kind of a development approach? Well, let's take a look at the treatment, because that's what this model does. It treats. So change in a multifaceted, multi-determined, and stage-oriented behavior change can emerge by starting this program. It's among a lot of different systems, a lot of different people, a lot of different domains, and interpersonal and intrapersonal processes, meaning how well do you relate to people outside yourself? How well do you relate to people inside yourself? And you start to think, oh my gosh, Roy, come on. I mean, we're really getting off the highway here. And I'm thinking to tell you with a lot of caution, no, this is the new highway. Get your map out, because this is where this drug journey is taking you. You may recall we discussed the idea that this is a journey, and it does require a roadmap, and that those are some of the things that we will be discussing. Well, guess what? Here we are discussing that. So the motivation is kind of malleable, but it's not assumed in terms of how motivated are you? I mean, we would sit there and think, well, this is the one person that you care about, and all the other family members you care about. I mean, this is your family. It's love, and it's support. There's nobody who can do it better for you all than yourselves first. I hate to go back to that, colloquial. Put the mask on first before you try and help somebody else on the airline. I keep saying airline, on the airplane. So with that in mind, always be present in terms of when you start this therapy. Don't let yourself get off on tangents and sidebars. Stay on the topic that's being presented in the treatment. And your receptivity and your motivation is going to vary. You're going to be receptive to some ideas, you're going to be motivated and not motivated on others, but hopefully it'll kind of all balance out. And that's where other family members can help you as they're participating in this. So treatment reluctance doesn't necessarily mean failure in either the family therapist's part or you as the customer, the client, going through this treatment in this therapy course. And when you start to look at multiple therapeutics aligning, that's what you're going to find true here. So when we start to think about, us as individuals and interventions, this being fostered in terms of our competency, how well can we do what they're telling us to do? And it's like, well, Roy, you haven't really told us anything yet. All right, well, here's what it looks like. You go to a meeting with a family therapist, and they explain to you that multidimensional family therapy, after an assessment and your diagnosis as a family, is probably going to best serve you. And you agree that this is what you're going to commit yourself to over the next, say, it could be anywhere from 12 to 26 weeks. It's typically not longer than that. So with that in mind, it all depends on the severity of each member in the family. So what is the therapist doing? The therapist is going to have a relationship with you as an individual. The therapist is going to, and he'll have goals for you, or she'll have goals for you. And then the group of those family members, and hopefully you all come to the meeting every time together when asked to, then as a group, the group will have goals. Well, is that the extent of multidimensional family therapy? Well, that's not the extent of this person and this individual who's misusing drugs, all right? Remember, they're out in the community. They have friends, they have teachers, they have employers, they have coaches, they have all church members. They have all these different spheres that they are dysfunctional in, and that actually they have up to now used as being a part of their persona, their personal, their identification as a person. I am if I write down who I am, kind of a Stephen Covey list of, what roles in my life do I play? I'm a son, I'm an employee, I'm a grandson, I'm a brother, or I'm a sister, I'm a member of our church, I'm a student at school. These are the different roles that we have. Every one of those is something that we identify with and therefore are a part of who we are. It's how we express ourselves in our daily life. But now all of a sudden, this has become thwarted and corrupted and has become kind of it's no longer an asset to us because we're abusing drugs. So if that's the case, then multidimensional family therapy goes and meets with them too. And you're thinking, oh my gosh, you mean the family therapist talks to his teacher? Yep. Because he talks to his teacher, the family therapist talks to his teacher. Does that mean the family therapist talks to his coach? Maybe. How about his employer? Maybe. How about his other extended aunt and uncle, of which he's expressed he puts a lot of esteem in their opinion about him and looks for their guidance whenever things are going right or wrong, their approval or their guidance in how to do better. Definitely. Okay. That's the multidimensionalism of this. Okay. This person isn't just sitting down in a room with Jerry and then ask mom to come in, from the waiting room and include her. That's really not multidimensional family therapy. Multidimensional family therapy, that therapist rates and includes all aspects of this person's life. Isn't this a great way to go at it? I mean, remember how we said we want knowledge to go everywhere that the drug goes? Because ignorance is the drug addiction's oxygen. And if we can laminate knowledge over the top of ignorance, we will suffocate its oxygen. Well, this is the way that mental health can be worked into the equation. Do you kind of see why this over residential would probably, now everywhere that Jack goes, these people are a part of the program in helping Jack to be better. And they're all on board, at least they're aware of how they can contribute in a positive and moving forward, successful lifelong recovery environment. So the therapist is responsible and is emphasizing to promote participation in kind of like being motivated to these relevant people, create a workable agenda with a clinical focus, of course, that's their role, and provide therapeutic focus and be consistent throughout the whole treatment. They're going to prompt behavior changes, okay? That's their role. Let them do that to you. And then they're going to evaluate with the family, extra familiar family, others, ongoing success interventions, and with this feedback, create kind of a collaborative and revised interventions as it's needed. The therapist isn't going to save the child or undimensionalize, like tough love the child as proponents. They advocate that the adolescents and the parents and the people involved in this life become a part of this identified program. So when we're starting to take a look at what, this whole concept of multidimensional family therapy is, it's going to have to be something that you ask for. Probably not. It's going to have to be something that you scream for and demand and show that you're not going to take other than what is going to be most effective. We've already shown you a 71% reduction. We're saying we're going to cut their ability or their interest of using drugs well over half, almost 3/4. Really, how much do you need to have laid at your door to figure this out? This is very good process and pathways. Unfortunately, the mental health field, and I say this with a tinge of disappointment, because I am disappointed in how long it takes mental health family therapists to adapt to what is already clinically proven, because they get so caught up in their way of doing things that they're not interested in changing themselves. Well, maybe they should go get therapy. I think a lot of them should do, and they do in many cases. So, and that's a good thing. So with that in mind, we are going to change the mental health industry, okay? We're going to get smart as families. We're the consumers. It's our money that is being spent that's going into their pocket, and we want what is best. And if it's been empirically proven that multidimensional family therapy is going to work best, then darn it, that's what you should be asking for. That's what you should be demanding. And that's where you should insist that your money is spent. Even if it's a managed care that's spending it for you on your behalf, You need to talk to the managed care and say, no, don't go sending me off to somebody that has barely started to figure out cognitive behavioral therapy, and to think that that's going to be, the end to end all for us. That's not what we feel we need. And a lot of people, I am going to get some real feedback from the healthcare community. Don't you dare tell families that they should come in and tell us how to do our work. And I'm sitting there saying, you guys sat off of the sidelines and you didn't come up with answers, and our children are getting killed here. And we're tired of watching this happen. And if you're really in it, and you're really in it with us, then get on board, go back and start to take the courses that are needed to increase your practice so that you are providing us with the most effective, most efficient, most clinically proven therapies that are available today. I don't want to hear that this is how we used to do it in the early 2000s. That's not where we are right now. We've learned an awful lot since 2001, and we've made leaps and bounds on successes. We want those now, not later, and not because you don't feel that you need to make the effort to get certified or become a clinician that provides that. If that's the case, then you go sit off on the sidelines, because we're trying to save the life of our family. And that's our interest, okay? So with that in mind, we're going to switch off now, and we're going to address some questions that people send in from time to time. And I thought, these are worthy of giving this, some air in terms of, exactly, what are we hearing from, the public. And we had one question that was submitted, and they said, I kind of wrote it down. Roy, in your podcast number 2, Family as a System, and we're going back here, you asked about the functionality of each family member. How are we to know what it is, and what are these different levels that were mentioned? And I have to apologize in a certain way, because I don't mean to tickle you with an idea and then not fully support it. There's a lot of work on your side. Of course, I do ask that you go to familiesimpactedbyopioids.com and view our materials. I do ask that you order the books, the Family Solution Finder Learning Series, which you can pull down as PDFs from our website. You can get the titles and go on Amazon if you want to have a hard copy. They're basically $10 a book, and there's 4 books as part of the 4 modules, and start to take these courses. You can look up on our YouTube channel and type in the search field fentanyl and families in harm's way, and all of these 32 seminars are presented in a TV episode, one for each, and they include how to determine a solution, develop a decision, and design a plan of action. 3 coping skills for each of them. So not only do we give you the information and we tell you what it is, we tell you how you show yourself in the workbook how it's impacting your family, and then you use the 3D coping skills for that issue. So, we're not just presenting in this podcast, hey, let's talk about this, and then we walk away and say, good luck. That's not where we're coming from. The podcast supports the website, which supports the Family Solution Finder Learning Series, which is a series of 4 learning module books, and has video to guide you through each issue. If that doesn't work for you, give us a call. We'll walk you through it. That's what we're here for. 440-385-7605. Take us up on it. So I want to answer the question about the levels. Yes, this is work that you'll need to do with a therapist, okay? We're not expecting that you're going to look at the functionality of each person inside your family and sit there and say, oh, well, Jerry, we don't think you're very functional. That's not what we're talking about doing. We're talking about that with a therapist, you look at, how is Bill doing? He's not the one that's misusing, but he's Bill's brother. He's John's brother. And Bill seems to be identified as not functioning too well. He's in this scenario, let's say he's not doing well with his friendships, and his schoolwork is very spotty. His coach has kind of a problem with his performance. He's very argumentative and disruptive in the family when we're all talking. This isn't the same Bill. Well, yeah, right. Well, that's called the drug is impacting your family dynamic. And as we discussed in the Family as a System podcast, and go back to that and listen to it if you forget what was said, then there is a way that we can start to compartmentalize and look at these things so that we can look towards making a difference with a therapist on board, okay? This isn't you doing it. But in collaboration with them, you're the eyes and ears for the therapist. You're seeing what he's doing. And the fact is the therapist is working with you at this point, not Bill. It probably will work with Bill. But, how are you responding to Bill's, new behavior based the fact that Bill is trying to cope with the fact that his brother is addicted to opioids and now has moved into heroin and fentanyl. And this is just tearing this poor guy's life apart. And he doesn't know how to deal with it. He doesn't know how to cope with this. He doesn't have the skills yet. So now we might find when we take a look at Bill, and this is why we're saying, listen, the family matters. This is your environment. This is your world. It's your everything. So now all of a sudden you're sitting there saying, well, what are we going to do? Well, the family therapist will more than likely do some kind of assessment, and it may be that one of the different types of anxieties is being presented. There's many different types of anxieties that could be applied. There's general anxiety disorder, there's social anxiety disorder, what they call SAD, S-A-D. There's panic disorder, there's phobias, there's obsessive compulsive disorder, there's post-traumatic stress disorder, there's separation anxiety. And you sit there and think, oh my gosh, because Jack's using drugs, Bill is now possibly exposed to all this? Yeah, but so are you. So's your mother and your father. All of you are. That's what we mean. This drug addiction tears apart the family. It presents to the family situations that are very difficult to cope with. And typically we don't know how to. I'm in that boat too, with you. So then the thought is, all right, well, if you're presenting it, I hope you got an answer here. The answer is you're going to have to work, okay? You're going to have to start to make changes in the way that you do what you do and how you think and your thought life. And, you've got to be open to letting a family therapist help you walk through this with you. So what are they going to do? They got a sundry of tools that are empirically proven from studies and examples of successes with large populations. Cognitive behavioral therapy is one of them. It's probably the most used one for depression and anxieties, post-traumatic stress disorders, things such as that, which you are more than likely experiencing as you go through this journey as family members. There's acceptance and commitment therapy, known as ACT. And ACT is widely used. I think they're using a lot of mindfulness in that course of treatment, therapy. So the other is exposure therapy. This is where they kind of expose you to a specific area of the anxiety and let it be experienced while you're being guided, so that now you can kind of see yourself and see the anxiety, see them in two different spheres, and start to nurture or manage or live alongside of whatever that is and what it causes. Mindfulness-based cognitive therapy, MBCT. Everything seems to have an acronym to it, so you got to get used to that. Dynamic therapy. This is where we unconsciously have a thought and we don't know where it comes from. But a therapist can help us to kind of like take that apart and give it some air and let it be known and then start to deal with it. Dialectic behavioral therapy is outstanding, and it's relatively new, but it's being widely used in substance use disorders, and it's also being used with families that have substance use disorder in their family dynamic. And then there's interpersonal therapy. This is really good, IPT. What that's doing for us is it allows us to start to understand the interpersonal relationships that we conduct and how successful we are and what areas create barriers for being more enriched and in its environment and its personal contribution to who we are in our relationships. So we took a look at answering the question today of, how do we know what level we're at? Well, That comes with a therapist, and that comes with a therapist kind of breaking apart the pieces of your family environment. And then should there be somebody that needs, help, which is very, very possible, and it's good, then that can be identified and treated kind of as a sub session. And then what we'll start to do is they'll start to include the family more as a dynamic in how supportive. Is it possible that mom has therapy going on individually, dad has it, so does Sally and Bill? Yeah, actually it is possible for, maybe 10 sessions. These things don't go on forever like they used to. And if they are, you might want to take a look at another therapist. Something's wrong. So the fact is, you can get help, but it's more valuable to you if you know what you're talking about. So then, where does all this come from? I mean, who creates this kind of stuff, and who examines it, and who's the authority that says, well, this is the way it should be done? And well, clinical papers. So I'd like us to kind of get used to the idea that as we journey together in these podcasts, as you come up with our YouTube channel and you're taking the television kind of classroom study of families, fentanyl and families in harm's way, which takes you through the 4 learning modules of the Family Solution Finder Learning Series. Do yourself a favor and know that these are, everything that we're saying comes from some clinical study of significance. None of this material was created by us. We're not here to try and act like we're smarter than we are. We're not. But we're smart enough to guide you to something that is smart, and you should give it some credence. And then seek a professional in your world to onboard and marry up with, so that they can truly become that, that conduit towards you moving forward, with confidence that it's clinically based and it's good, it's legitimate, it has credibility. So we're going to take a look at a clinical journal, and this comes from the Journal of Substance Abuse Treatment. I have it in front of me, although if you're seeing this, you can see that, but if you're listening to it on audio, it's a multidimensional family therapy as a community-based alternative to residential treatment for adolescents with substance use and co-occurring mental disorders. Now, this is how you look at a clinical paper. You look at the title and you say, kind of sounds like what I'd be interested in. And then you'll be given the authors: Howard A. Little, Gail A. Dockoff, Cynthia Rowe, Craig Henderson, and Paul Greenbaum, Wei Wang, and Linda Alberg. So, then you say, well, that's fine. Where are these people from? Well, University of Miami, Miller School of Medicine, significantly credible. Sam Houston State University, Huntsville, Texas, very credible. University of South Florida, Tampa, very credible. So what the clinical paper starts off with is it gives you something called an abstract. All clinical papers have this. The nice thing about an abstract is it tells you a little bit about what was the rationale for the study, and then kind of a little bit about what did the study do, and then a little bit about what it concluded. But you really want to go to the end of the clinical paper and read the title of the paragraph that says conclusions. Yeah, go figure. That makes sense. A lot of this makes sense. Don't be intimidated by a clinical paper. They're not intimidating. The nice thing is they'll make a statement in a paragraph, and then you'll see in either italics or parentheses the author of where that statement came from. So, and I'll show you in just a minute. In reading the abstract, it states, this randomized clinical trial compared multidimensional family therapy with residential treatments for adolescents with co-occurring substance use and mental health disorders on substance use, delinquency, and mental health symptoms. Using an intent to treat design of 113 adolescents who had been referred for residential treatment were randomly assigned to either a residential treatment or a multidimensional family therapy. So they're taking this population, they're saying, we randomized, we didn't pre-select, or we didn't have bias, and we put these same types of people in these two different treatment paths. So the sample was primarily male, 75%, Hispanic, 68%. That tells you a little bit about their demographics, and they typically do that in the abstract. 71% of youth had at least one previous residential treatment placement. So 71% of this population had been through a residential treatment prior to this. The participants were assessed at baseline 2, 4, 12, and 18 months. So that's when they came in and they said, let's do a reassessment and see where you are, and they did that incrementally. Okay, so now you're getting a little bit of an idea as to how this study was set up. And during the early phase of treatment, baseline to 2 months, youth in both treatments showed significant reductions in substance use. Well, that's great. It just basically said we paid attention to them, we got them into an environment where we were interacting with them, and they responded. So the youth receiving multidimensional family therapy reported a significantly greater reduction in internalizing symptoms than youth receiving residential treatment. Oh, so in that time period, 72% as opposed to 42%, there was a really big decrease in multidimensional family therapy. In phase 2, from 2 to 18 months, remember everything's on a timeline when it comes to studies. After baseline, the youth in the multidimensional family therapy, their earlier treatment decreased in substance use problems, frequency of use, and delinquent behaviors, and more effectively than the residential treatment. During this period, there were no significant treatment differences in maintenance of gains of externalizing symptoms. So in other words, there wasn't, for all this population, anything from outside themselves or from what they were doing inside themselves that was dramatically, changed. Meaning they didn't change themselves, and therefore that therapy had a greater or less than impact. So what results suggest that multidimensional family, they always have a concluding paragraph to an abstract, which is towards the end. Results suggest that multidimensional family therapy is a promising alternative to residential treatment for youth with substance use and co-occurring disorders. The results, if supported through replication, are important because they challenge the prevailing assumption that adolescents who meet criteria for residential treatment cannot be adequately managed in a non-residential setting. Do you see what we said? This basically puts a stick in the eye of those that would say there's no other alternative, you have to send them to residential treatment. Because now with this clinical paper, if you have credence in how they conducted their study, and the methodology is listed in the study on how they went about that, then you could come to some assumptions that you really should be taking a look at multidimensional family therapy. It's been proven. So with that in mind, it goes on to, you'll have an introduction section to the clinical paper, and that will typically kind of set up the stages of residential treatment. It kind of gives you a little bit of a history, typically. Residential treatment has typically been the recommended intervention for youth with substance use and mental health disorders who have not responded to less restrictive treatments, require stabilization, present a danger to themselves or their families, or demonstrate a public safety risk. So, and that study, they quote a study for that statement. Remember I said they'll make a statement and then they'll give you where they found that to be studied in depth, and that's why they're making this statement. Then they go on to say most youth referred to residential treatments present with a spectrum of substance use, mental health, and delinquency problems. So there's many problems. That's what spectrum typically means. And then either as a consequence of significant substance use and mental health challenges, youth referred to residential substance use abuse treatment evidenced impairment in many areas of life, included educational, vocational, family, social, and legal. Now, what they're basically saying is, hey, listen, this person may be going into an isolated residential treatment, posture, but the fact is, they've got a whole life out here that's standing still that they're going to return to, and because they were in this isolated environment, now coming back into it, none of those people have moved forward in their environment and influence. So that's kind of like oh, gee, wish we could change that. Well, we can with multidimensional family therapy. So then the study goes on to suggest that materials and methods, and this is called methodology. And what they'll do is they'll say, here are the characteristics of the samples we used in our study. Then they'll say, here are the assessment and procedures we used. Then they'll say, I'll have a paragraph on, here are the treatments that we used. And then they'll go on in the study and they'll identify a little bit about each type of treatment. Because just to say that you used a specific type of treatment and not say how it was used or in what domain it was used isn't very helpful for the person who's reading the study. Now, typically, when you start to talk about results, you're comparing it to a baseline. So you'll want to look in a study and say, so where's the baseline? And then how did this individual or this group of individuals respond in terms of identifying, was there a group that responded faster than others? If so, why? And then they'll give you their data findings. And typically with these types of clinical studies, it's in a timeline. So at 2 months, remember we said that they did an assessment at 2, 4, and 12 and 18 months? This is the follow-up for that. And they give you the data so they can show you, the reader, this is the data that we gathered when we made this assessment. And this is these are the facts that were numerically. Typically, you'll find some kind of flow chart that identifies if, then, go to. If we saw this, we went to that, and we consistently, and then they kind of demonstrate that, result on, problem severity. You'll see that a lot. Mild, moderate, and severe severity are ways that we can sit there and say, oh, wow, look at this. With MDFT, they dropped significantly in the first 2 months, but so did they with residential treatment. Both dropped significantly. And then all of a sudden at around 12 months, our residential therapy crosses over the path of the multidimensional family therapy. In other words, the lines crisscross. Now all of a sudden residential therapy is not performing as well. It's going up, meaning now they're starting to use more. Whereas with the multidimensional therapy, they're still going down. So it kind of creates an X spot on a line chart. So with that in mind, we then get to the area of the paper of a study where it offers us a conclusion. Conclusion, according to the National Survey on Drug Use and Health, SAMHSA, 2017, in 2016, over 1 million youths between the ages of 12 and 17 needed substance use treatment. Only 180,000 received any treatment whatsoever, leaving over 900,000 untreated youths. That's, I'm looking at this industry and saying, are you kidding me? That's the best you could do? And they're looking at us saying, hey, if you don't come to us, then what can we do for you? And I'm looking at us saying, hey, listen, come on, families, get on board. You got these resources here. They're clinically proven to work. But my gosh, if 900,000 of you out of a million, are not getting into these services, then you're part of the problem. I want you to be a part of the solution. I want you to get down there and start using these services in an educated and informed way. And hopefully, this podcast will begin your YouTube search, your discussions with drug coaches, drug counselors, family therapists, people in the mental health field, your local health organizations. Although I really wouldn't count on the government and your county agencies to do this for you. If you've got that expectation, you're way off base. All of this sits in your corner. As family members, we need to be empowered. We don't need to be spoon-fed. Those days are over. There's too much information available on the internet for us to sit there and ask somebody to please tell us what we need to think. If you're in that position, you got a long way to go. You need to get out of that way of thinking real quick. So I'll go back to the conclusion. Given the approximately 15% enrolled in residential care, it is vital to policy, funders, and clinical directors and parents to know whether the benefits of residential treatment outweigh their cost in comparison to the less restrictive, non-residential alternatives such as the multidimensional family therapy. In current studies, MDFT produced outcomes that were equal to or better than residential therapy in both the short and long term, suggesting that the multidimensional family therapy is viable, less costly alternative to residential treatment for use with serious co-occurring substance use and mental health disorders. Well, that's one survey. That's one study. I'm not going to take the time because I want to challenge you as my listening audience. I want you to pull down from the internet Multidimensional Family Therapy for Adolescent Substance Use, a Developmental Approach by Howard A. Little. Well, why would I do that? Well, because Howard A. Little is the man who created multidimensional family therapy. Don't you think we should kind of look at him first? I do. So with that in mind, go ahead and pull down this. It's from Interventions in Addictions, Volume 3. And all you do is a Google search. Once again, multidimensional family therapy for adolescent substance use disorder. And then a developmental approach, and then Howard A. Little. And you will come up with this as a PDF on your Google search. I want you to print it out. And yeah, that's right. I want you to read it. And I want you to know that there's an introduction and that there's a methodology and that there are assessments and that there are discussions of how the treatments were done and what the outcomes were. And then in the back of the whole scientific paper is conclusion. And this is not hard. Okay? Come on now. We've been through the pandemic and we were, lied to and given truth in so many different places in that it just made your head spin. The fact of the matter is that there were scientific papers and there were opposing views, and we should be consumers of healthcare in everything that we do. I want to thank you for taking the time today to listen to this podcast. I hope you found it to be of value. If you'd like to talk, please call us at 440-385-7605. If you have questions, I'll put them up on the next podcast that I have available, and that can be emailed to families, IES, impacted by BY opioids, OPIOIDS, at gmail.com. Once again, this is Roy Poyan. I am a chemical licensed in the state of Ohio chemical dependency counselor and a certified mental health coach, and I want to thank you very much for allowing me to join you at your family table.
Stand up for yourself, and I'll back you up, 'cause problems don't solve themselves. I'll tell you what, instead of would or could, I think you should draw a line in the sand and stand your ground. It's for your own good.